Hello and welcome to Abby Cares Health Talk, our series on Ask a Doctor. So today we have a very special guest in the house, but let me introduce myself first for our viewers that are stopping by for the first time. I am Mrs. Nneka Nwankwo. I'm also an epidemiologist and the director of Abby Cares Foundation, an NGO that provides public health prevention intervention services in Nigeria. So today is our Ask a Doctor series, and we have our medical director here, who is also a family physician at Alex Ekweme Federal Teaching Hospital here in Abakaliki. She is a community health expert and also an immunization advocate. It is an honor to welcome Dr. Edith Nwankwo in the house. Doc, you're welcome.
Thank you so much.
Okay. What we're trying to do here today is to shed some light on a very important topic that a lot of people think that is gone because 24th of this month is World Polio Day. And the theme this year is End Polio, Every Child, Every Vaccine, Everywhere. So it makes sense to have Dr. Nwankwo, who is a family physician that works in the community here for us to talk about polio and the impact the primary healthcare center plays in disease eradication and prevention.
Thank you, Mrs. Nneka, for having me here. Hello everyone. I'll be talking about polio, its impacts, preventive measures, and treatment options. So, polio is a very contagious viral disease caused by polio virus, which is being transmitted through fecal-oral routes and rarely through respiratory droplets. There are two types of polio viruses that causes this poliomyelitis. We have poliovirus 1 and poliovirus 2. So this polio, how does it manifest? 72% of it is asymptomatic, while some other percent goes on to have minor illnesses. On a lesser percentage, goes on to have a central nervous system effect.
Which is, sorry to cut you off, which is what polio is known as, like the paralysis,
Yeah,
right?
Okay. Classic paralysis
Of the legs.
which affects mainly the legs.
Mm-hmm.
So the asymptomatic ones, anyone can get the polio virus, but you can have it without knowing that you have the polio virus. The body will just get rid of it on its own without you having any symptoms. While some other ones will go ahead to manifest with gastrointestinal symptoms,
Like stomach problems.
like stomach problems, gastritis, fever, vomiting, and all that, malaria. While some will also go ahead to have respiratory symptoms like sore throat and flu-like symptoms. Then the lesser percentage, the unfortunate ones, the polio virus goes into the central nervous system, affecting the neurons and causing damages to the neurons, thereby killing off the neuronal cells. And this is what leads to what?
The paralysis. Okay, you know, when I was growing up years back, like in the 80s and early 90s, I think I went. One of my schoolmates, he was using crutches, so he was paralyzed, and he had like his legs were very very tiny. And I remember that asking my mom what happened, and my mom said it was polio. And I think people of a certain age will look back. Then I remember, somebody that has So, and I remember during that time also, they were doing vaccines, oral polio vaccine. They will come to schools, health workers will come, and they'll be dropping the polio vaccine in your mouth. So, which leads me to the next thing, because this year the theme is every child, every vaccine, everywhere. So, I think the theme this year is like more of an inclusive, inclusive thing to improve vaccination, because I think Nigeria made a breakthrough in 2020 where wild polio virus now was eradicated. But now we have the type 2 that you mentioned earlier, which is due to the lapse in vaccine.
Yeah, low vaccination coverage.
Yes.
Especially in hard to reach areas. So that is what is bringing up this vaccine derived polio virus now, because the type 2 polio virus is now an emerging disease. And the cause is because in those hard to reach areas, hardly do they get vaccinated. Okay, hardly do they get vaccinated. So this is where we have cases coming up. Yes, Nigeria eradicated polio in the
And it was a big thing.
Yes,
it was a big milestone for Nigeria. For as a public health expert, it was like
celebrated.
it was celebrated.
Yes. So but now those hard to reach areas is now the problem, because so children, because this is a disease that affects children.
Yes.
Do you understand? So if you are unimmunized, probably when you come in contact with the virus, the person can get infected.
Yes, and it's very fatal. And I remember when you look at the disease trends from the 40s to the 1980s. I think the kickoff was in 1988. So when we look at the trend, we see that the vaccine is very effective, like 99% effective.
About yes, 99.9%,
and it was a big breakthrough. So the vaccine really works. And I know vaccines now have been in the headlines for different things, but we're not going to get into it. But we know that the polio vaccine works. But unfortunately, a lot of children in Nigeria, especially in the north now, don't have access to the vaccine due to either insecurity, poor infrastructure, poor road networks, and so many other things. So polio is not a thing of the past. It's still quite present. In as much as we don't really give Nigeria kudos on some things, from public health perspective, I really feel proud about our accomplishment when it comes to wild eradication of polio. And I think Nigeria, we have done really well in the past when it comes to our community-based sensitization and our door-to-door campaigns. And I really hope that we can go back to the drawing board and do the things we used to do very well at. I mean, look at how we tackled Ebola, and we were able to do that. We can do the same thing on polio. So that's why we feel like on this World Polio Day, we want to shed light on something like this to let people know that it's still happening. Yeah. So we've talked about the importance of vaccine and the need to continue with the polio campaigns and all of that. Another thing that I said earlier was Nigeria being really doing a good job when it comes to community health. Now, in communities, we know their first line of defense, which is the primary healthcare center. As a public health expert, primary healthcare center is where not the only place our interest lies, but we really, really we feel like if you get it right at the primary health level, you will get it right at the tertiary. You are at the tertiary level. You see a lot of bottlenecks at the tertiary level. Every doctor in Nigeria knows that. So let's talk about what role the primary health sector plays in disease prevention, especially with things like polio now. So what are your experiences as a family physician at the primary health sector level?
As an advocate, what we do mainly is education, health education, where you educate the women about this disease condition, teaching them good personal hygiene. As I said, one of the means of transmission is fecal oral routes. So when you educate these women about personal hygiene, proper hand washing, proper waste disposal, and all that, they will learn to keep their environment clean.
When it comes to disease prevention, like you said earlier, education plays a big role.
Yes.
Yeah,
Education, early diagnosis,
yes,
and
detection, they play a big role. And I think, when people think of education when it comes to healthcare or medical services, they feel like, oh, everybody needs to know what the big words is. That's not what the community needs. Just to understand the mode of disease transmission, how will you get this disease, the things you need to do to prevent these diseases. Just something simple as hand washing.
Something simple as hand washing.
If you,
and hand washing is not just pouring water in your hands.
just
to teach them
proper hand washing technique with soap and water. Yeah.
Exactly.
So, like you said, education. I know, like one of the health centers we work in one of the primary health centers. I think the first time I went there, I saw the Veronica buckets. I have not seen that in such a long time. But I saw something so simple.
Yes.
The Veronica bucket was there, a bar of soap was there.
Yes.
And these women in the community, every person that finished there, they would just go and wash their hand and leave.
Yes.
Something so simple, but with major impact. And I was very impressed with the OIC that was there, because these patients or these women or anybody from the community now knows the importance of proper hand washing. So, I mean, you guys have your work cut out for you as family health physicians, because, being on the receiving end of education is not easy, but you will still have to convey the message to the community, and so, and another thing is, you have to maintain that balance as a physician, and at the same time as a community advocate. So how are you able to, like, encourage those ones that are so resistant, like, okay, with all the things we're hearing about vaccine now, I don't want to vaccinate my child, though they say vaccine causes this and that. How do you still get the message across?
You have to keep pushing. Whenever you, like the pregnant women, whenever they come for antenatal visit, you still educate them on immunizing their children. After delivery, they need to immunize their child against disease preventable illnesses. Do you understand? So you keep encouraging them, teaching them that these diseases are actually preventable with immunization. That it helps them to build up their immune
system and all
against those diseases. So we can bring a picture and show them that, okay, look at this child. Because this child is not vaccinated, that is why this child came down with this kind of disability. Like, you can get a picture as we are celebrating polio.
Polio
can get a picture of
and then show them
with
polio
paralysis on the legs, and show them, do you want your child to be like this? They will tell you no, because no mother will want the child.
And I think a lot, most people, the message is well received. Like, with this whole vaccine thing, again, we're talking about the PHC, primary health centers. When they come, some of them, the thing, you need to keep records now. You come with your vaccination card and everything. Even though some of them don't really know what is written there, they are there to vaccinate either their grandchild or their child, and to let you know that, okay, I know I don't understand this thing, but I'm here. I'm here to do this. So, Dr. Wanko, thank you so much for coming and talking to us about polio and the impact or the role that primary healthcare sectors play in disease prevention. Because I know you see a lot at the tertiary level. Like you always say, you have a bottleneck. But we're trying our best to kind of like triage the situations at the primary healthcare centers before we come to you.
Together we can.
We can.
So what's the message here? To the public, be informed, get vaccinated.
Yes.
Together we can make
polio a thing of the past. Thank you so much. Please follow us on our social media handles, Instagram, Facebook. Our website is www.abicaresfoundation.org. Subscribe, like, comment. Let us know what we can do or what topics we can always cover to bring you more information. See ya.